Welcome back to Port Huron Hospital's Today's Health Program. I'm speaking today with Dr. Timothy Lucas about knee pain. Dr. Lucas, how do you diagnose the various different causes of knee pain?
So first it starts with a thorough history from the patient. I'll have the patient in the office. I'll ask, was there an injury that precipitated the pain? There may or may not have been. When does it hurt? Where does it hurt? Does your knee swell? Do you have mechanical symptoms like catching or locking, or does your knee feel like it wants to give out when you do certain maneuvers? What makes it better? What makes it worse? Have you had a history of things going on in the past? So there's lots of questions that can give us clues to what's going on and what's causing the pain. Once I'm done with the history portion, then I'll move into the physical examination. Physical examination is very thorough. I look at the range of motion of the knee compared to the other side. If there's any swelling or effusion in the knee, that can give us clues to the severity of the injury or where the injury is. Point tenderness tends to be quite helpful. In addition, I look at the ligamentous stability, and I also perform provocative maneuvers to help give more information on what might be going wrong inside the knee. Once I'm done with the physical examination, I always get a weight-bearing x-ray on my patients. That gives us an indirect sign of if there's arthritis, how much wear of the cartilage has gone on, and that may complicate things with injuries on top of arthritis. But it's very important to get a weight-bearing x-ray. Sometimes MRIs can be quite helpful too. They can show the soft tissue structures, the ligaments, the cartilage, the meniscus. It'll also help us gain insight as to what the injury is, what we can do about it, and kind of go from there. We're fortunate in this area to have an MRI with a 4 Tesla magnet over here at Port Huron Hospital. It gives us the best images available. Once I'm done figuring out exactly what is going on, then we can decide what to do for them.
What are the treatment options?
So treatment options, depending on the pathology, I usually start with conservative measures. If there's an acute injury, the old adage of RICE, rest, ice, compression, and elevation is a good place to start for anyone that has an acute injury to their knee. Anti-inflammatory medications can be quite helpful too to help with swelling and pain. Physical therapy sometimes to get motion and strength back can be quite helpful to work on flexibility. People that are inflexible tend to be more prone to injury, so physical therapy sometimes can be quite helpful. Sometimes injections, aspirating, and putting cortisone, which is a potent anti-inflammatory in the knees, can promote healing and get people past the acute pain episode. Lubrication type of medications tend to be quite helpful for patients that have arthritis, doing like a lube job for the knee.
Dr. Lucas, at what point do you decide to recommend surgery?
For the patient that once we've figured out what their problem is, if they have a ligamentous instability, sometimes surgery is more towards the front of what we're going to do for the patient. But if other patients, we try the conservative measures first. If those fail and they continue to have pain, locking, giving way, instability, that's when we decide it's time to move to the next step.
What are the different types of surgeries that you can do to help repair a knee?
So fortunately, over the past several years, there's been innovations in orthopedic surgery. Arthroscopy has really advanced over time. We're able to do surgery most of the time arthroscopically, particularly for these acute type of injuries. That type of surgery involves 3 small puncture wounds, less than 1/5 inch each, where I'm able to put a camera that has high definition optics inside the knee to get a very clear picture of what is going wrong, in addition to being able to precisely fix, contour, or repair the damaged structures.
What are the benefits to this type of surgery?
Arthroscopy, the benefits is it doesn't involve much in terms of tissue injury to do the surgery, so people recover faster, have lesser pain, and can get back to their normal activities faster.
About how long is the recovery time for this surgery?
With arthroscopy, that's an outpatient procedure, so you come in and go home the same day. You're able to put full weight on it right away. I usually have people using crutches for a day or 2 after the surgery. Then we progress getting their motion and strength back. That may involve some physical therapy in the first couple of weeks after the surgery. It can be anywhere from 2 to 4 weeks for most people to get back to full speed.
How about a total knee replacement? At what point do you recommend that, and what is that surgery about?
Sure. The Total knee replacement is done for patients that have arthritis that has progressed to the point where the conservative measures aren't working anymore. It's very reliable for pain relief. Once the pain has gotten to the point where it interferes with their lifestyle and their function, and they can't function the way they want to, that's when I recommend knee replacement surgery. That type of surgery, come in the hospital, most people stay 3 to 4 days, which is much shorter than it used to be. It used to be over a week. You're able to put full weight on the knee after the surgery. I usually have people using a walker for the first 2 weeks, a cane for 2 weeks, then down to nothing after that. Total recovery time, after 1 month, people are doing pretty well, getting back to most functions. After 2 to 3 months, back to full activity.
Now, I've heard a lot of hype lately about this robotic partial knee replacement surgery. Can you tell us about that?
Certainly, there's a lot of hype out there, to be certain. Partial knee replacement is good for some patients. Unfortunately, the vast majority of patients with arthritis don't qualify or don't fit in those parameters. The knee is made up of 3 compartments, the medial, the lateral, and the patellofemoral. So partial knee replacement, just replacing one part of the knee when you have arthritis in 2 or 3 compartments, doesn't tend to last very long and sets people up for bigger surgery down the line.
Dr. Lucas, this has been great information. Do you have any closing comments?
Yes, I'd like to encourage people that have knee pain, that are limited by it, that knee pain that keeps them from doing things they want and need to do, to come in for an evaluation. There's a good chance we can pinpoint what your problem is and get you back on track.
Thank you very much for joining us today.
Thank you.
Stay with us. We'll return in a moment.